It happens every 45 seconds somewhere in the U.S. And it happens in Buffalo more than anywhere else in the state. Someone suffers a stroke, and a race against the clock begins. If you or someone you love suffers a stroke, call 911 immediately. It's important to get treatment within the first 3 hours from the onset of symptoms.
Hi, I'm Dr. Mike Meyer. Welcome to ECMC, a major teaching affiliate of the University of Buffalo School of Medicine. I'd like to talk to you today about stroke, which is the #2 cause of death in the world today. A stroke is a major blockage of an artery leading to the brain, usually caused by a clot that's stopping the flow of blood into a vessel, supplying the blood to the brain. We're using our skills as a trauma center to get a very quick response and treatment time for acute stroke patients.
ECMC is a leading trauma center, combining state-of-the-art diagnostic equipment with a team of exceptional and caring professionals, giving patients the fast treatment they need for the best outcomes.
When I was a resident in neurology at the Mayo Clinic in the late 1980s, we had no treatment for stroke. However, there was a treatment for heart attack patients using a clot-busting medication called tissue plasminogen activator, otherwise known as TPA. So myself and 8 other doctors got together for a study with the National Institute of Health to test whether or not this clot-busting medication could be helpful for patients with clots in the brain. The study was successful, and it's now used as a treatment worldwide for patients with acute stroke.
As important as the first response is, the next steps are just as critical, and ECMC is there to respond with a variety of rehabilitation services.
ECMC Rehab Services offers a full range of therapies for all individuals who have received stroke care at ECMC or other facilities. These therapies include occupational therapy, physical therapy, speech therapy, and recreation therapy. Rehab services are provided for both inpatient and outpatient care.
I'd like to now show you a case of an actual patient that came to ECMC with an acute stroke. This patient had a well-documented time of onset of stroke, with her family witnessing a sudden paralysis of her right side. She was brought immediately to ECMC, where a team of emergency room physicians and healthcare professionals evaluated the patient with neurology. She had a CAT scan of the brain that ruled out a bleed and had other lab studies that were done on an urgent stat basis. According to protocol set forth in our New England Journal of Medicine study from 1995, the patient seemed to qualify for TPA treatment. We did additional studies using a high-resolution 64-slice scanner to make a three-dimensional picture of the blood vessels in the brain. The scan demonstrates an occlusion of the left middle cerebral artery. The artery is completely blocked, telling us that this patient would be a good candidate for a TPA treatment. She did receive treatment within the 180-minute time window and did very well and had a good outcome. She completed her care at ECMC Rehab.
ECMC is uniquely ready to help stroke victims from the life-saving first moments and every step along the way, because all of us are held in the same high standards, the culture of care.